Let's discuss face diagnosis zones. If an abnormality occurs at a certain area of the face, it usually indicates that there is a problem with the internal organ pertaining to it. First, we have the mental stress zones. The upper third of the forehead to the hairline. If acne appears here, or if the skin color in this area is different from the general complexion of the face, it indicates that the person is experiencing mental stress. If skin spots occur, it means that the pathogenic changes may have developed with the heart. Example, cardiomyopathy. If a mole or wart develops, it points to a congenital problem with the function of the heart. So we have here the picture of the mental stress zone in the forehead. Heart zones. On the bridge of the nose between the eyes, if horizontal creases develop or are clearly evident, it suggests arrhythmia or problematic heart conditions. If the horizontal creases here are deep, coupled with vertical cracks on the surface of the tongue, it often indicates a serious heart disease. Lung zone, the midpoint of the line linking the start of both eyebrows. If the forehead has a deeper than normal depression in the center of the skin color is dull or bluish, or there are skin spots, means that the person is likely to have a lung disease or breathing problems. If acne appears here, it suggests that the person may have had a cold or sore throat recently. If there is a mole or wart at the start of the brow, or the skin color there is pale white, it indicates that this person may have a laryngopharyngitis or tonsillitis, oppression in the chest or shortness of breath, or some kind of lung disease. If the part directly above the start of the brow bulges above the skin, it also suggests lung disease. So we have here a picture of the lung zone. Chest, breast zone. The area between the bridge of the nose and the inner corners of the eyes. This part looks dull or bluish in a man. It suggests oppression in the chest and shortness of breath. If this part looks dull or bluish in a woman, it indicates that she may suffer from distending pain in the breast during menstruation. If there are moles or warts on the inner side of the upper eyelid or acne types of growth on the eyelid, it may indicate lobular hyperplasia in a woman or pleurisy in a man. If there are bumps in the inner corner of the eye, it reveals that she may have breast hyperplasia. So we have here the picture of the chest breast zone. Liver zone, the middle part, also the highest point of the bridge of the nose. If this part appears bluish, dark, or develops skin spots, it suggests problem with the liver. If there is acne, it is a sign that this person has hyperactivity of the liver fire. If the higher part of the bridge of the nose has skin spots, it may mean hyperactivity of the liver fire and unbalanced emotional state. If the bluish skin color in the bridge of the nose reaches the tip of the nose, it is a warning sign of cancer or a tumor. So we have here the picture of a liver zone. Next, the gallbladder zone, the lateral surfaces straddling the higher part of the bridge of the nose. If this part shows blood streaks or acne, or if the mouth tastes bitter when getting up in the morning, may suggest slight inflammation of the gallbladder. If there are skin spots, it points to cholecystitis. If there are vertical wrinkles or vertical wrinkles appear when smiling, it suggests problems with the gallbladder. If there are moles or warts, the person may suffer from congenital functional deficiency of the gallbladder or gallstones. So we have here the picture of the gallbladder zone. Thank you for your attention.
Let's go to interviewing. Topic is insomnia. Insomnia includes difficulty in falling or staying asleep. In general, sleep depends on the state of blood and yin, especially of the heart and liver, although the blood and yin of other organs also influences sleep. During the night, yin energy predominates and the mind and the ethereal soul should be anchored in heart blood and liver blood, respectively. Here we can see that the heart blood anchors the mind or the shen, and the liver blood anchors the ethereal soul or the hun. A sleep disturbance may be due to the mind and or ethereal soul not being anchored in heart blood or heart yin and liver blood or liver yin, respectively. This can happen either because there is not enough blood or yin to anchor the mind and or the ethereal soul, or because a pathogenic factor such as heat agitates them. The former is an empty type of sleep disturbance, the latter a full type. In both cases, the mind and or the ethereal soul is said to float at night, causing insomnia. In general, in deficiency conditions, a difficulty in falling asleep indicates a blood deficiency of the heart, spleen, or liver, whereas difficulty in staying asleep and a tendency to wake up during the night indicate a yin deficiency. Of course, waking up during the night also may be due to full conditions such as heat, fire, phlegm fire, or retention of food. When diagnosing sleep disturbances, it is important to distinguish first, a full from an empty condition, and second, a heart from a liver pattern. Full conditions are characterized by very restless sleep with a feeling of heat, agitation, and excessive dreaming. Empty conditions are characterized by not being able to fall or stay asleep without any of the above symptoms. A liver pattern causing insomnia is characterized by excessive dreaming, and when compared with a heart pattern, a more severe restlessness. However, the heart and liver are not the only organs that may cause insomnia. The stomach, spleen, kidneys, and gallbladder may play a role in insomnia. For example, a deficiency of spleen blood often accompanies a deficiency of heart blood and contributes to causing insomnia. The famous formula Gui Pitang, tonifying the spleen decoction, treats insomnia from these patterns. Kidney yin, like liver yin, also needs to anchor the mind and the ethereal soul at night, and therefore a deficiency of kidney yin with or without empty heat is also a frequent cause of insomnia. A deficiency of the gallbladder and heart may cause someone to wake up early in the morning without being able to fall asleep again. A less common cause of insomnia is residual heat in the diaphragm, which may occur after an invasion of wind heat. This is obviously an acute type of insomnia with recent onset. Let's look at a summary of the causes of insomnia. So if it's insomnia with difficulty in falling asleep, it's blood or yin deficiency of heart, spleen, or liver. Insomnia with difficulty in staying asleep is yin deficiency with empty heat of most organs, but especially heart, liver, or kidneys. A restless sleep with excessive dreaming is full heat of the heart, liver, or stomach, or phlegm fire, stomach, and or heart. When it's waking up at night with a dry mouth, dreaming, and night sweating, there's empty heat of the heart, liver, or kidneys. When there's restless sleep with abdominal fullness, it is retention of food. And waking up early in the morning is gallbladder and heart deficiency. We must remember that difficulty in falling asleep generally indicates a deficiency of blood or yin, whereas waking during the night generally indicates yin deficiency with empty heat. Thank you so much for your attention.
Let's talk about Wuxing, the five-phase theory in disease causation. The engendering and controlling cycles of the five phases are used to explain disease causation, mainly through the mother-son relationship. In addition, a condition of excess or deficiency in one of the organs can affect other organs by altering the relationships of engenderment and control. Disease causing through the mother-son relationship. Disease of the mother affecting the son. If the mother becomes deficient, it will be unable to nourish the son and will eventually cause a deficiency of the son. For example, a deficiency of the kidney essence, which is water, will negatively impact the production of liver blood, which is wood, gradually inducing a condition of liver deficiency. Conversely, if the mother is affected by an excess condition, this may cause the son to become excessive as well. For example, if liver fire flares up, it will cause heart fire to be exuberant, leading to an overabundance of fire in the liver and the heart. Disease of the sun affecting the mother. In most cases, a disease of the sun will induce a deficiency of the mother. For example, a deficiency of kidney yin can induce a deficiency of lung yin, leading to deficiency of both organs. This is explained as due to the increased supply from the mother to the deficient sun, eventually exhausting the resources of the mother. Disease causation through deficiency or excess of an organ. Deficiency of one of the organs can induce any of the following scenarios. Deficiency of the sun due to reduction of nourishment, deficiency of the mother due to increased demand for nourishment, over-controlling from its controller, which would aggravate the deficiency, counter-domination by its controlled organ. The excess of one of the organs can result in any of the following. Excess of the sun, excess of the mother, over-controlling of its controlled organ, causing debilitation of the latter, counter-domination of its controlling organ, causing its debilitation. The 5 phases in diagnosis and analysis of symptoms. It is important to point out that although 5-phase correspondences exist for many diagnostic signs, in actual clinical practice, these findings need to be correlated to the entire diagnostic picture developed through the use of the 4 methods. In all cases, TCM needs to correlate a large amount of concurrent data in order to arrive at a diagnosis, and in this context, the actual relevance or meaning of any one sign or symptom may vary when analyzed in relation to the whole. That being said, certain signs such as facial complexion, odor, tone of voice, etc., can be used as indicators of disease or pathology affecting the corresponding viscous per 5-phase theory or the associated mother organ or son organ. This can, in some cases, be used also to construct an entire therapeutic strategy according to the 5-phase engendering and controlling cycles, as will be explained in the next section. Thank you for your attention.
Diagnosis according to Sanjiao theory, we discuss liver heat generating wind. In this pattern, exogenous pathogenic qi has injured the liver's yin aspect and generated heat in the liver. The heat causes liver wind to stir, and the deficient yin cannot control it. This pattern corresponds to the pattern of blood heat generating wind in the 4 levels diagnostic model. Etiology: exposure to exogenous pathogenic qi that has created heat in the liver and injured liver yin. Symptoms and signs: seizures and convulsions, stiffness of the neck muscles, muscle spasms, cramps and tremors, grinding of the teeth, headache, dizziness, red eyes, upwardly staring eyes, irritability, mania, fever that is worse at night, thirst, dark red tongue without coating, rapid fine pulse or wiry pulse. Key symptoms: fever, cramps, stiffness of the neck muscles, dark red tongue, and rapid pulse. Treatment principle: drain heat from the liver, nourish liver yin, and calm wind. Acupuncture points to choose from: Jingwell points, Sichuan points, bladder 62, SI3, spleen 10, LI4, liver 2 and 3, 8, gallbladder 20, do 16 and 20, and spleen 6. Needle technique: draining apart from spleen 6 and liver 8, which should be tonified. The Jingwell and Sichuan point should be bled. Jingwell points, Sichuan points, and LI11 drain heat. Liver 2 and 3 drain heat from the liver and calm wind. Gallbladder 20, do 16 and 20, disempiang and calm wind. Spleen 6 and liver 8 nourish liver yin. Relevant advice: the person will probably be in intensive medical care. Liver heat generating wind can be caused by upper jaw heat, middle jaw heat, and kidney heat, and can result in kidney heat. To recap, extreme heat generating wind has invasion of exterior heat or wind heat penetrating to the blood level, generating internal wind as etiology. Underlying accompanying pathology: this pattern is only encountered with acute febrile diseases. Possible presenting conditions: measles, encephalitis, meningitis. Signs and symptoms: high fever with thirst, red face and eyes, convulsions, rigidity of the neck and back, upward staring eyes, clenched jaw, tremor of the limbs, coma in severe cases. Pulse, wiry, rapid, tongue, deep red, stiff, dry yellow coating. Treatment principle, calm the liver and extinguish wind, clear heat. Acupuncture treatment, we use gallbladder 20 to extinguish interior wind, Li 11 to subdue hyperactive liver qi, heart 8 to quiet the heart, regulate spirit, liver 2 to clear liver heat, the extra point Sichuan clears heat, extinguishes wind, do 20 to extinguish interior wind, liver 3 to disperse liver, subdue wind, pericardium 8 to extinguish wind, cools blood, do 8 to extinguish wind, relieve spasm, do 14 extinguish wind, clear heat, SI3 to extinguish wind from governing vessel, do 16 to extinguish interior wind. Needle with drainage and prick 12 well points to bleed. Thank you for your attention.
Let's now discuss Zhang viscera, the spleen relationships. The relationships of spleen to other organs and tissues. The intimate relationship between the muscles of the entire body and the spleen is a direct consequence of the transforming and transporting function of the spleen. The muscles depend upon the nutrients derived from food and drink, whose delivery is directed by the spleen. When spleen qi is abundant, transformation and transportation are normal. Qi and blood, fluids and essence are also abundant and can be supplied to the entire body without interruption. The muscles can then develop fully and become strong and thick. If spleen qi is deficient, transformation and transportation are reduced. The muscles lose their nourishment and become flaccid and weak and even atrophied. The four limbs of the body must be nourished with the essential nutrients from food and drink and transported under the control of spleen qi. Abundant spleen qi ensures adequate supply of nutrients so that all four limbs become well-developed, agile, and strong. Deficiency of spleen qi, on the other hand, leads to inadequacy of nutrients so that the limbs become weak with flabby muscles or pseudo-hypertrophy, sometimes to the point of losing the ability to stand. The spleen opens into the mouth and has its outward manifestation in lips. The mouth is located at the upper end of the digestive tract and is the place of entrance for food and drink. The chief organ for receiving and digesting foodstuff is the stomach, and the chief organ for producing and transporting nutrients is the spleen. Hence, both the spleen and the stomach are closely connected with the mouth. If spleen qi is normal, then appetite will be hearty and taste normal. As the spirit pivot states, spleen qi passes through the mouth. If the spleen is functioning harmoniously, then the mouth can taste the 5 kinds of flavor. Conversely, if the spleen is abnormal, there may be impaired appetite and altered taste. If the dampness evil encumbers the spleen, there may be a viscous and sweet taste in the mouth. If the spleen yin is deficient, there may be dryness in the mouth and proneness to hunger. The spleen has its outward manifestation in the lips, signifies that the color and luster of the lips can reflect the state of the spleen's functionality. The reason is that the spleen is the source of qi and blood and controls the muscles, and the lips are formed of muscles. If spleen qi is vigorous, qi and blood are abundant, and the lips are red, moist, and lustrous. If the spleen qi is deficient, qi and blood are also deficient, and the lips become pale and dry or sallow. From the foregoing description, it is clear that the spleen qi has the leading role in the physiological activities of the spleen. Only when the spleen qi is ample can the spleen function normally in transportation and transformation, in raising the clear, in stabilizing the location of the internal organs, in commanding the flow of blood, and in conveying nutrients to the whole body. Thank you for your attention.
Let's discuss diagnosis according to Sangfu organ patterns: block, heart vessels. This is a combined pattern that will have its root in several patterns, with the common feature that they block qi and blood in and around the heart. The most common pattern that are the cause of this imbalance are heart qi stagnation, heart blood stagnation, cold, and phlegm. Theology. Emotional stress and long-term emotional imbalances can stagnate heart qi and eventually heart blood. Overwork, too much sex, and sweating while exposed to cold will all weaken heart yang and can thereby stagnate heart blood. Consuming damp, producing food can lead to the formation of phlegm, which can block the movement of qi and blood in the heart. Symptoms and signs, there is piercing and stabbing cardiac pain. The pain is usually worse when the person is exposed to the cold. There's palpitation, shortness of breath, tight or heavy sensation in the chest, purple, matte or white and pale complexion, mental unrest or unease, depression, mental and physical fatigue with an oppressive feeling, dizziness, headiness or headache, pulmonary sputum, cold hands, blue or purple lips, purple nails. The tongue may be pale and swollen with greasy coating. It can be purple in the front third. Wiry, choppy, or slippery paws. The paws can be knotted. Key symptoms, there is sharp or stabbing chest pain, purple lips, and breathlessness. Treatment principle, invigorate heart qi and blood, transform phlegm, expel cold, and calm the shen. For the acupuncture points, choose from pericardium 5, 6, heart 5, Ren 14, Ren 15, Ren 17, UB 14, UB 15, UB 17, spleen 10, and stomach 40. Needle technique is spreading technique. For the explanation, heart 5, pericardium 6, Ren 14, Ren 15, UB 14, UB 15 invigorate heart qi and heart blood. Spleen 10 in UB 17 invigorate blood. Ren 17 circulate qi and blood in the upper jaw. Pericardium 5 and stomach 40 transform phlegm and move qi in the chest. Relevant advice, like physical activity, will be beneficial. However, it is important that the person does not overexert themselves if there is an underlying deficiency pattern. Beating the chest and the upper back with a loose fist or a wooden spoon or rolling the shoulder and swinging the arms can also be recommended. As well as getting adequate exercise, it is also important that they get sufficient rest and relaxation. They should avoid stress and overexerting themselves physically. If they play sports, it is important that they do not expose themselves to the cold when they sweat. They should avoid foods that create dampness and phlegm. Block heart vessels can be caused by heart blood stagnation, heart qi stagnation, phlegm, cold, liver qi stagnation, spleen qi deficiency, spleen yang deficiency, kidney yang deficiency. Blocked heart vessels can result from phlegm, heart blood stagnation, qi deficiency, yang deficiency. Thank you for your attention.
Let's go to qi transformation, main patterns, part 2. The influence of heart and kidney on qi transformation. The heart is located in the upper jaw. It houses the mind and its nature pertains to the fire element. The kidney is located in the lower jaw. It stores essence and its nature pertains to the water element. The polarity of the heart and the kidney is a fundamental polarity between fire and water. Physiologically, heart fire descends into the kidney and together with kidney yang warms kidney water to prevent it becoming cold. Kidney water rises to the heart and together with heart yin moistens heart fire to prevent it from hyperactivity. The relationship between the descent of heart fire and the ascent of kidney water must maintain the same balance as that seen between water and fire, between yin and yang, and between above and below. In CM, this is known as the harmony between the heart and the kidney, or mutual support of water and fire. What is the mechanism and underlying the balanced relationship between the heart and the kidney? The heart pertains to fire, but there is water within fire. The kidney pertains to water, but there is fire within water. When water fails to ascend, it is due to deficient kidney yang being unable to raise water. When fire fails to descend, it is due to deficient heart yin being unable to lower fire. Consequently, there appears disharmony between the heart and the kidney, or discordance between water and fire. The development of disharmony between the heart and the kidney is usually due to kidney yin not being able to augment heart yin. If heart yin is unable to restrain heart yang, then heart fire may blaze, causing insomnia, agitation, and impatience. The harmonious interaction between the heart and the kidney is pivotal to Qi's ascent and descent, since the heart and the kidney directly affect the actions of Qi in other Zhang organs. On the one hand, the kidney and liver share a common source. If kidney yin cannot nourish liver yin, liver yang will rise and become hyperactive, giving rise to headache, impatience, and irascibility. On the other hand, the heart and the lung are both located in the upper jiao. Deficiency of heart qi can impair the lungs' functions of dispersion and depuration and cause lung qi to become stagnant in the chest. This can give rise to tightness in the chest, coughing, and labored breathing. The normal functioning of the spleen and the stomach is also dependent upon the balance between ascent and descent of heart qi and kidney qi. The heart and the kidney provide fire and water, which constitute the foundation for the stomach's ability to receive and absorb, and for the spleen's ability to transform and transport the essence of drink and food. Transformation of Sanjiao qi. The Sanjiao is one of the Fu viscera. At the same time, it encompasses all the internal organs. Its basic function is to ensure that all passages remain open so that qi can flow without impedance. Water metabolism can proceed smoothly, and waste can be excreted properly. The Sanjiao can facilitate the flow of genuine qi, thereby providing the motive force for qi throughout the body and for all the processes of metabolism. Hence, the classic on medical problems states, the Sanjiao is the ambassador of genuine qi. It controls the circulation of the 3 kinds of qi and distributes them to the 5 Zhang and the 6 Fu viscera. The Sanjiao is the highway for the circulation of water fluids. The plain question states, the Sanjiao is the official in charge of dredging. From its action, the waterways are cleared. This explains that its main function is to enable the entire process of qi transformation of the body's fluids and to ensure free passage through the waterways. If this function is impaired, qi stagnates and so does water, resulting in edema and ascites. Every part of the Sanjiao has its own functions, particularly concerning qi movement. In summary, the Sanjiao controls the correct movement of every type of qi and in this way ensures its proper actions. As Hua Tuo points out in the classic of the secret transmission, if the Sanjiao is patent, then all pathways are patent in the interior, in the exterior, on the left, on the right, above, and below. In the task of irrigating the entire body, harmonizing the interior, regulating the exterior, nourishing the left and the right, and dispersing and conducting the upper and the lower, there is nothing more important than this. Thank you so much for your attention.
Now let's talk about the second overview on the emotions. On clinical note, emotions become causes of disease only when they are either long-lasting or very intense. Each emotion stems from a psychic field that pertains to the relevant yin organ. This, in fact, explains why a certain emotion affects a specific organ. That particular organ already produces a certain psychic energy with specific characteristics that, when subject to emotional stimuli, responds to or resonates with a particular emotion. For example, an external stimulus resonates with the liver's psychic energy, giving rise to anger. Thus, emotions are not something that comes from outside the internal organs to attack them. The internal organs already have a psychic energy that turns into a negative emotion only when triggered by certain external circumstances. This figure shows us how external stimuli's conversion of the liver's mental energy into emotion. For example, why does anger affect the liver? If one considers the liver's characteristics of free, easy, and quick movement with a tendency for its qi to rise, its correspondence to spring when the powerful yang energy bursts outward and upwards, and its correspondence to wood with its expansive movement, it is easy to understand that the liver would be affected by anger. This emotion with its quick outbursts, the rising of blood to the head that one feels when very angry, the destructive, expansive quality of rage mimics on an effective level the characteristics of the liver and wood outlined above. The same psychic and affective qualities of the liver that may give rise to anger and resentment over many years under normal circumstances are also harnessed and used for creative activities. The healthy counterpart of emotions will be considered further when each emotion is discussed in detail. In Chinese medicine, emotions as causes of disease are mental stimuli that disturb the mind or the shen, ethereal soul or the hun, and corporal soul, po. And through these, they alter the balance of the internal organs and the harmony of qi and blood. For this reason, emotional stress is an internal cause of disease that injures the internal organs directly. On the other hand, this is a very important feature of Chinese medicine. The state of the internal organs affect our emotional state. For example, if liver blood is deficient, perhaps from dietary factors, and causes liver yang to rise, this may cause a person to become irritable all the time. Conversely, if a person is constantly angry about a certain situation or with a particular person, this may cause liver yang to rise. The spiritual axis in Chapter 8 clearly illustrates the reciprocal relationship between the emotions and the internal organs. It says, the heart's fear, anxiety, and pensiveness injure the mind. The spleen's worry injures the intellect. The liver's sadness and shock injure the ethereal soul. The lungs' excessive joy injures the corporal soul. The kidney's anger injures the willpower. On the other hand, further on it says, if liver blood is deficient, there is fear. If it is in excess, there is anger. If heart qi is deficient, there is sadness. If it is in excess, there is manic behavior. These two passages clearly show that, on the other hand, emotional stress injures the internal organs, and on the other hand, disharmony of the internal organs causes emotional imbalance. The emotions taken into consideration in Chinese medicine have varied over the years. From a 5-element perspective, the Yellow Emperor's Classic considered 5 emotions, each one affecting a specific yin organ. Anger affects the liver, joy affects the heart, pensiveness affects the spleen, worry affects the lungs, and fear affects the kidneys. Thank you for your attention.